In the realm of discomfort, urinary tract infections or UTIs stands as one of the most common and irksome afflictions. These pesky infections can send even the toughest amongst us scrambling for relief. Thankfully, medical science has paved the way for a range of medications designed to combat these unwelcome invaders. In this video, we delve into the top 10 medications for UTIs in the US. So if you've ever found yourself facing the persistent discomfort of a UTI, watch until the end to discover the weapons at your disposal in this battle for relief. Disclaimer: the information provided in this video is for educational purposes only. It is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of a qualified healthcare provider with any questions you may have regarding a medical condition. Never disregard professional medical advice or delay in seeking it because of something you have watched in this video. A urinary tract infection or UTI can unleash a flurry of uncomfortable symptoms that often include a persistent, urgent need to urinate, accompanied by a burning sensation during urination. The affected individual might notice their urine appearing cloudy or tinged with blood, and they could experience discomfort or pressure in the lower abdomen or pelvic area. UTIs can bring about a feeling of incomplete emptying of the bladder, even after urination. Sometimes individuals might encounter mild fever, fatigue, or general malaise. If these symptoms arise, particularly in combination, they might signal the presence of a UTI, prompting the need for timely medical attention and appropriate treatment. Let's take a look at the top 10 medications to fight UTI. Number 10. Trimethoprim or sulfamethoxazole. The first soldier in our arsenal is the potent combination of trimethoprim and sulfamethoxazole, commonly known as Bactrim. This antibiotic tag team takes down UTI-causing bacteria by inhibiting their growth. It's often prescribed due to its high efficacy against common pathogens. For uncomplicated UTIs, the normal adult dosage typically entails 1 Bactrim DS tablet, 160 mg over 800 mg twice a day, with intervals of 12 hours between doses. A full glass of water should be taken with each dose, regardless of food consumption, to reduce the risk of stomach upset. Number 9. Nitrofurantoin, or macrobid. Marching forward, we encounter nitrofurantoin, celebrated for its ability to wage war specifically within the urinary tract. This antibiotic disrupts bacterial cell walls, rendering them defenseless. Commonly used for uncomplicated UTIs, the normal adult dosage of macrobid usually involves one 100 mg capsule every 12 hours. To maximize its effectiveness, it's best taken with a meal to aid absorption. If you have questions about your medication, we created a book just for you. 10 questions everyone should ask their pharmacist. Link down in the description below. Please check them out. Number 8. Ciprofloxacin. Ciprofloxacin, a formidable fluoroquinolone antibiotic, makes its appearance as the next contender. It targets the DNA of bacteria, effectively crippling their ability to multiply. Generally, for uncomplicated UTIs, the normal adult dosage involves 250 mg to 500 mg taken twice a day, with an interval of 12 hours. However, it's important to note that Cipro comes with a potential risk of serious side effects, including tendon rupture and nerve damage, so it's usually reserved for cases where other antibiotics have proven ineffective. Number 7. Levofloxacin. Levofloxacin, a close relative of ciprofloxacin, also occupies a prominent place in our lineup. With similar mechanisms of action, levofloxacin too inhibits bacterial DNA replication, leading to their demise. For uncomplicated UTIs, the normal adult dosage usually involves 250 mg to 750 mg taken once daily, with a dosing interval of 24 hours. It's worth noting that, like Cipro, levofloxacin also carries the risk of serious side effects. Number 6. Fosfomycin. Amidst the heavy artillery of antibiotics, fosfomycin stands out as a unique agent. It disrupts the formation of bacterial cell walls, incapacitating their ability to survive. For uncomplicated UTIs, the normal adult dosage typically entails 1 3-gram sachet taken as a single dose, dissolved in water. This single-dose regimen offers convenience and has gained popularity as an alternative treatment option. Number 5. Amoxicillin clavulanic acid augmentin. In the relentless battle against UTIs, amoxicillin and clavulanic acid, combined in the formulation known as augmentin, collaborate to overcome bacterial resistance. While amoxicillin attacks bacterial cell walls, clavulanic acid safeguards amoxicillin from degradation by bacterial enzymes. The normal adult dosage often involves one 875 mg tablet taken twice a day, with intervals of 12 hours. Number 4. Cefdinir, Omnisa. Cefdinir, a cephalosporin antibiotic, steps into the fray with a mode of action that prevents bacterial cell wall synthesis. This robust defense mechanism ultimately leads to the bacteria's downfall. For uncomplicated UTIs, the normal adult dosage generally involves 300 mg taken twice a day, with intervals of 12 hours between doses. Number 3. Sulfamethoxazole trimethoprim, or SMZ-TMP. The dynamic duo of sulfamethoxazole and trimethoprim, also available under the brand name SMZ-TMP, re-enters the scene with their tried-and-true approach to bacteria annihilation. This time-tested combination disrupts essential folic acid synthesis within bacteria, preventing their reproduction. The normal adult dosage typically involves one double-strand tablet, 800 mg over 160 mg, taken twice a day, with an interval of 12 hours. Number 2. Norfloxacin, or Noroxin. Norfloxacin, another member of the fluoroquinolone family, continues to fight with its DNA-targeting approach. By binding to bacterial DNA gyrus, this antibiotic hinders bacterial DNA replication, spelling doom for the invaders. For uncomplicated UTIs, the normal adult dosage often involves 400 mg taken twice a day with intervals of 12 hours. Number 1. Doxycycline. Concluding our lineup is doxycycline, a tetracycline antibiotic with a broad spectrum of action. While primarily used to combat infections beyond the urinary tract, it can still play a role in treating certain UTIs. Doxycycline inhibits bacterial protein synthesis, curtailing bacterial growth. The normal adult dosage usually involves 100 mg taken twice a day initially, followed by 100 mg once daily for the remainder of the course. Intervals between doses should be 12 hours for the initial phase and 24 hours thereafter. An array of antibiotics stands ready to quell the discomfort caused by these common infections. Each medication in this formidable lineup offers a unique mechanism of action, ensuring that even the trickiest bacterial invaders can be defeated. However, it's crucial to remember that these medications are not without their potential side effects, and their use should be under the guidance of a healthcare professional. Now, a quick question to you, our dear viewers. Do you know any natural remedies to help fight UTI? Let us know down in the comments below. For a more comprehensive understanding of this topic, please see the description box. We provide a list of the top 10 questions to ask your pharmacist when picking up your medication. This is not an all-inclusive list, and if you need more information, check out the link below. Welcome to Dr. Vivian Medications and Natural Supplements. Our channel is dedicated to providing valuable information on health and wellness that's made by a licensed professional. Times are crazy, and it's extremely important to be well-informed and taking care of yourself. If you enjoyed watching, please help us out by liking this video. In this way, we will know how well we're doing. And if you like more of these, consider subscribing and hit the bell notification to stay on top for more upcoming videos. Thanks for watching.